So today we're going to talk about Starling forces. Okay, and Starling forces just deal with the movement of water in and out of a capillary. Okay, and so we're just going to say, here is our capillary, right? So capillary is in here. Okay, and then out here is what we call the interstitial space. Now, in the blood, we have blood cells, we have proteins. So here's my blood cells, here are my big proteins, okay? But a majority of the blood is made up of water, okay? Capillaries are leaky. They're leaky by design so that things can get in and they can get out, okay? And so fluid, along with the things that are dissolved in the fluid, are able to exit the capillary, and they're also able to be pulled back into the capillary. Large things such as red blood cells and proteins, however, are not. Now, when it comes to the movement of water, there are two primary mechanisms by which this can occur, or there's two pressures. And then there's two mechanisms. So we're going to talk about the pressures first. So the first one is hydrostatic pressure, okay? Hydrostatic pressure is just water pressure, okay? And so with water pressure, that's causing the fluid in a container to want to leave or to want to exit. So we call this a pushing force. I want you to imagine a water bottle. You've got water in your water bottle. Where does that water want to go? It wants to leave, okay? And unless you've got a leaky water bottle, the water can't leave, it stays in, but it's still exerting a force on the walls of your water bottle. And then on the other side, we have osmotic pressure. Gotta make sure I spell osmotic right. Okay, osmotic pressure is pressure due to the, it's pressure that's created by solutes and proteins. Now, normally, these solutes or proteins can move down their gradient. However, if we're in an impermeable place, so for example, right here in the capillary is not permeable to proteins. It's not, and so proteins can't go from high concentration to low concentration. However, in order to balance out the concentrations, the proteins can pull water back in. And so osmotic pressure is a pulling force, so it pulls water in. All right, now with these pressures, we actually have four pressures that we're going to talk about. And so we've got hydrostatic pressure, and so we're going to call it big P cap. So it's hydrostatic pressure in the capillary. Then we've got osmotic pressure in the capillary, so we represent that with the Greek letter pi. And then in the interstitial space, we've got hydrostatic pressure of the interstitial fluid. And then we've also got osmotic pressure in the interstitial fluid. Okay, remember, the hydrostatic pressures are pushing, so hydrostatic capillary pressure is going to push fluid out of the capillary into the interstitial space. However, the hydrostatic pressure in the interstitial fluid is going to push fluid out of the interstitial space into the capillary. Now, the reverse is true when it comes to the osmotic pressure. Osmotic pressure is a pulling force, so the interstitial osmotic pressure is going to pull fluid into the interstitial space, whereas the osmotic pressure in the capillary is going to pull fluid into the capillary. Now, generally, this one is generally zero because we don't normally have a lot of proteins floating around in the interstitial fluid. When we do, that's usually indicative of some sort of problem, okay? But it can exist, all right? So notice that we've got two forces that are causing fluid to leave the capillary and two forces that are causing fluid to enter the capillary. Any fluid, or any force, excuse me, that causes fluid to go into the go out of the capillary is a filtration force. So this is out of the capillary. Okay, so what forces are causing fluid to leave the capillary? And the answer is hydrostatic capillary pressure as well as osmotic interstitial fluid pressure. Then the other one that we've got are what we call reabsorption forces. And these are the exact opposite. So with reabsorption forces, it's fluid going into the capillary. And so here we've got osmotic capillary pressure as well as hydrostatic interstitial fluid pressure. Now, in order to determine whether or not fluid is moving, if more fluid's leaving the capillary, entering the capillary, it's relatively simple. What we do is we just add up the filtration forces, we add up the reabsorption forces, and we subtract these two. If the filtration pressure is greater than the reabsorption pressure, that means more fluid is leaving the capillary than is entering. If the reabsorption pressures are greater than the filtration pressures, that means more fluid is coming back in. What's really interesting is that at the beginning of the capillary, you have a lot of filtration. Fluid is generally leaving, more fluid is leaving than is coming back in. By the time we get to the end of the capillary, we actually have a lot of reabsorption pressure, and so we're bringing more fluid back into the capillary. Generally speaking, it's pretty close to the same. So we lose fluid at the beginning, we gain that fluid back at the end, and so we're not really losing blood. And so that is your introduction into Starling forces. And we're going to talk more about that as we get into the urinary system, specifically with how the glomerulus, which is a capillary, interacts with what's called the Bowman's capsule, which is where fluid goes that will ultimately become urine.